So we here in California are making progress against COVID, but what is the big picture around the world, let's say? Dr. Nicholas Testa is the Chief Medical Officer for Dignity Health Southern California, joins us now. First off, good morning, Dr. Testa.
Good morning.
So people are starting to think more broadly about travel. I mean, if you think about young kids, maybe studying abroad in the fall for college, what are we seeing internationally with COVID?
So, this weekend, if you even just look at yesterday, there were 731,000 new cases around the world. That's the highest number of new cases we've ever seen. So over the last 14 days, we've seen a 22% increase. So, I think we're feeling relatively confident in the United States that our numbers are decreasing. But I think it's a good moment to realize that worldwide, we are still deep in the throes of a pandemic that really is peaking around the world.
Are there specific hot spots? I know India has seen a bit of a surge.
Yeah, it's been moving around the globe. So India has seen a significant surge in just the last 2 or 3 weeks. Before that, it was Brazil. There's pockets of Europe where we've seen surges. So yeah, I mean, it is blooming throughout the world.
So what are you hearing about the possibility of, I guess we'll call it a fourth wave? I mean, it's hard to assign these waves, but what do you think we here in the States are going to see in the coming months?
I think your comment right there about it being hard to assign these waves is very accurate. I think what we're going to see and what we have seen is that we're going to go in and out of waves of COVID for the coming future, the foreseeable future. So, March to April, we definitely saw an uptick in cases throughout the United States. There was a lot of talk about, is this a fourth wave? But then about 2 weeks ago, we saw that start to decrease. Now, most of that was focused on the East Coast, with Michigan being particularly bad. But the most interesting thing about it that I glean is that the patients who were being hospitalized were actually under 60, which is different than what we were seeing in all the other waves, suggesting that the vaccine is actually making an impact in protecting those patients who are in the older populations.
Okay, you've just transitioned us right perfectly to the vaccine. A lot of people have gotten the vaccine, they wanted it, they got it very quickly, but there are still those who are hesitant. I don't want to say they're anti-vaxxers, but they're just hesitant. What is it going to take to get us to herd immunity? I know we need 85%, but how do we get those people who are hesitant vaccinated?
Well, I think maybe what we're going to need to do is stop trying to make herd immunity the target, because there's a lot of people out there who are saying we may never get to herd immunity for several reasons. The one that you just alluded to, that there's those people who are going to always be vaccine hesitant, but then also there are limited distribution networks. So there's some pockets where they're just not vaccine getting to. And then finally, we're seeing variants throughout the world. So the truth is we may need to pivot away from believing that we're going to get to herd immunity, which would be wonderful, right? Because if we have herd immunity, we really then believe that we've gone back to normal. Instead, we may have to do what we really sort of got away from when this all started, which is to say, let's just try and dampen the effects of COVID. And we've been really avoiding saying COVID is like the flu. But if we get our vaccine out there enough, we can dampen the effects, protect enough people so that COVID becomes something that's just ubiquitous to the environment and that we deal with, yet is not nearly as lethal as it currently is.
Okay. Well, thank you once again. It's always a pleasure to talk to you, Dr. Nicholas Testa, Chief Medical Officer, Dignity Health Southern California. Have a great day.
You too, Phil. Okay.